The world watches with bated breath as another deadly virus emerges. The Marburg virus, a highly infectious and deadly disease, has reared its ugly head. This time, the epicenter is East Africa, where it threatens to spiral out of control. With the echoes of the COVID-19 pandemic still fresh in our minds, the emergence of Marburg virus is a stark reminder of the vulnerability of humankind. The virus, known for its high fatality rate, has sent shockwaves across the globe. The recent outbreak, declared in Equatorial Guinea and Tanzania, has already claimed several lives. Health officials are racing against time to contain the virus and prevent its spread. The situation is a grim reminder of the devastating consequences of infectious diseases. It underscores the importance of robust healthcare systems and global cooperation. The world is on high alert, fearing a repeat of the COVID-19 pandemic. Governments and health organizations are working together to prevent a global health crisis. The fight against Marburg virus is a fight for our collective health and well-being. The outbreak serves as a reminder of the ever-present threat of infectious diseases. It highlights the need for continued investment in public health infrastructure and disease surveillance. The world cannot afford to be caught off guard again. The Marburg virus is not a newcomer to the world of infectious diseases. Its first appearance dates back to 1967, when simultaneous outbreaks occurred in Marburg and Frankfurt, Germany, and in Belgrade, Serbia. The outbreaks were linked to laboratory work on African green monkeys imported from Uganda. This incident marked the first time the virus was identified, and its deadly potential was realized. The virus, named after the German city where it was first discovered, caused severe illness among laboratory workers. It quickly spread to healthcare workers and family members who came into contact with infected individuals. The initial outbreaks resulted in dozens of cases and a significant number of fatalities. The 1967 outbreaks served as a wake-up call to the global health community. They highlighted the dangers of zoonotic diseases, which can jump from animals to humans. The incident also underscored the importance of laboratory safety and infection control measures. The Marburg virus, though not as well known as some other deadly viruses, has been responsible for several outbreaks since its initial discovery. These outbreaks, primarily in Africa, have resulted in high fatality rates ranging from 24% to 88%, making it one of the most lethal viruses known to humankind. Marburg virus disease is a severe, often fatal illness in humans. It is characterized by sudden onset and rapid progression, making it a critical concern for healthcare professionals. It is caused by a virus belonging to the filovirus family, which also includes the notorious Ebola virus. Both viruses share many similarities in their structure and mode of transmission. Like Ebola, Marburg virus causes hemorrhagic fever, often leading to severe internal bleeding and organ failure. This hemorrhagic nature of the disease is what makes it particularly deadly. The virus attacks multiple organ systems including the liver, kidneys, and circulatory system, causing widespread damage. This multi-organ involvement complicates treatment and increases the fatality rate. The virus is transmitted to humans through contact with infected animals, primarily fruit bats. These bats are often found in caves or mines where humans may come into contact with them. These bats, considered the natural reservoir of the virus, can carry and transmit the virus without showing symptoms themselves. This asymptomatic nature in bats makes it difficult to identify and control the source of the virus. Once the virus jumps from bats to humans, it can spread through human-to-human transmission, making it highly contagious. This secondary transmission is a major concern during outbreaks. Human-to-human transmission occurs through direct contact with the bodily fluids of an infected person. This includes not only blood but also other fluids like saliva and vomit. This includes blood, saliva, vomit, urine, and feces. The virus can survive in these fluids, making them potent sources of infection. The virus can also spread through contact with contaminated surfaces or materials, such as bedding or clothing. Proper disinfection and disposal of these materials are crucial to prevent further spread. The virus's ability to spread through multiple routes makes it challenging to contain. Strict infection control measures are essential to manage outbreaks effectively. Symptoms of Marburg virus disease typically appear after an incubation period of 2 to 21 days. This variability in the incubation period can complicate efforts to identify and isolate infected individuals. The initial symptoms are often non-specific and may include fever, chills, headache, muscle pain, and a rash. These early symptoms can be mistaken for other illnesses, delaying diagnosis and treatment. As the disease progresses, symptoms become more severe and may include nausea, vomiting, diarrhea, abdominal pain, jaundice, and bleeding from various sites, including the eyes, nose, gums, and gastrointestinal tract. The severity of these symptoms often necessitates intensive medical care and can lead to high mortality rates. The current outbreak in East Africa is a cause for serious concern, affecting multiple regions and communities. Two countries, Tanzania and Equatorial Guinea, are grappling with the deadly virus, which has already claimed several lives and infected dozens more. The situation is dire, with both nations struggling to contain the spread. The World Health Organization, or WHO, has declared the outbreak a Grade 3 emergency, its highest alert level, signifying a serious public health threat. This declaration underscores the severity of the situation and the urgent need for a coordinated response. In Tanzania, the outbreak was first reported in the northwestern region of Kagera, bordering Uganda. This region is known for its dense population and cross-border movement, which complicates containment efforts. Cases quickly emerged in healthcare workers, indicating human-to-human transmission. This is particularly concerning as it suggests the virus can spread rapidly within healthcare settings, putting both patients and medical staff at risk. The virus then spread to the Bukoba district, raising concerns of a wider outbreak. Bukoba, being a significant trade and transport hub, poses a high risk for further transmission. The Tanzanian government has implemented strict control measures, including isolation of suspected cases, contact tracing, and safe burial practices to curb the spread of the virus. These measures are crucial in preventing further transmission and protecting the community. Meanwhile, in Equatorial Guinea, the outbreak is centered in the Kiantem province, bordering Cameroon and Gabon. This region's remote and rural nature makes it challenging to access and provide timely medical intervention. The first cases were detected in a remote village, but the virus has since spread to the provincial capital, Bata, the country's largest city. Bata's dense population and urban environment facilitate the rapid spread of the virus. This rapid spread has raised concerns about the potential for a larger outbreak. The urban setting of Bata, with its bustling streets and high population density, poses a significant challenge for containment efforts. Equatorial Guinea authorities have responded swiftly, imposing travel restrictions, closing schools, and banning public gatherings in affected areas. These measures aim to limit the virus's spread and protect the population. The outbreaks in both countries are challenging due to several factors, including limited healthcare resources, remote locations, and community resistance to control measures. Overcoming these challenges requires a multifaceted approach and strong community engagement. The situation highlights the need for international collaboration and support to contain the virus and prevent its further spread. Global health organizations, governments, and local communities must work together to address this public health crisis effectively. The emergence of the Marburg virus comes at a time when the world is still reeling from the devastating effects of the COVID-19 pandemic. This new threat has reignited fears and concerns that had only just begun to subside. The pandemic, which caused widespread illness, death, and economic disruption, has left a lasting impact on global health systems and public psyche. The scars of COVID-19 are deep, affecting not just physical health, but also mental well-being and economic stability. The memories of lockdowns, travel restrictions, and overburdened hospitals are still fresh in people's minds. These experiences have reshaped our daily lives, altering how we interact, travel, and even think about our health and safety. The specter of COVID-19 looms large over the current Marburg virus outbreak, fueling public anxiety and fear. The constant media coverage and the rapid spread of information, both accurate and misleading, contribute to a heightened sense of vulnerability. The parallels between the two viruses, both highly contagious and potentially deadly, are hard to ignore. These similarities make it difficult for people to remain calm and rational as the fear of another pandemic looms. The rapid spread of COVID-19 and its devastating consequences have made people more aware of the threat of infectious diseases and more susceptible to fear-mongering. This heightened awareness, while beneficial in some ways, can also lead to panic and irrational behavior. The COVID-19 pandemic has also exposed and exacerbated existing inequalities in healthcare access and preparedness. The disparity between wealthy and low-income countries has never been more apparent, highlighting the urgent need for a more equitable global health system. Low-income countries with limited resources and fragile health systems are often hit the hardest by outbreaks. These regions struggle to cope with the influx of patients and the lack of medical supplies, making the situation even more dire. The pandemic has highlighted the urgent need for strengthening global health security and ensuring equitable access to vaccines, treatments, and diagnostics. It has shown us that no one is safe until everyone is safe, emphasizing the importance of global cooperation. The world cannot afford to be complacent. Continuous investment in research, healthcare infrastructure, and emergency preparedness is essential to safeguard against future threats. The Marburg virus outbreak serves as a stark reminder that the threat of infectious diseases is constant and ever-evolving. Vigilance and proactive measures are crucial in preventing another global health crisis. We must learn from the lessons of COVID-19 and strengthen our global health defenses to prevent and respond effectively to future outbreaks. By doing so, we can build a more resilient and prepared world, capable of facing any health challenge that comes our way.